Good evening. My name is Akash Nair. Today I'll be talking about the least talked about harmful practices, harmful traditional practice that is going on in our world right now, which is called female genital mutilation, FGM. FGM, female genital mutilation, currently takes place in about roughly 30 countries in our world. These countries are in Africa, Asia, and in the Middle East. It has been said roughly about 200 million women in our world right now have already undergone this procedure. It has been said 9 out of 10 women and girls aged 15 to 49 years old have already undergone this procedure. This shows the frequency of this happening in these regions. That begs the question, what is female genital mutilation? Why does it happen? How does it happen? Female genital mutilation is the partial or complete removal of the external female genitalia for non-medical purposes. For example, this happens because in tribes in Africa, they have lack of education. They do not know this practice is harmful to their children. This causes the children to have severe pain. This practice usually undergoes to the children at infancy all the way till they are 15 years old. There are 4 ways female genital mutilation can happen, 4 types. Type 1 is called clitoridectomy. Clitoridectomy is the removal of the clitoral glands. Type 2 is called excision. Excision is where clitoral glands and the labia minora are removed from the genital area. Number 3, type 3. Type 3 is called infibulation. Infibulation is the narrowing of the vaginal aperture, which causes them to form a seal. This is done through sewing. They sew the female genital area. Type 4 is the combination of basically all 3 types. It includes scraping, incising, and many more of the genital region. With this procedure, they also bears very great health risks towards their children. One of the major health risks that happens to the victims of this procedure is it causes injury to the genital tissue. Other than that, it also causes them to have excessive bleeding. Furthermore, in some cases it may even lead to the victim dying due to the loss of blood. This shows how severe this issue is being done in our country, in this country, in the world. Even in Malaysia, in our country, some places still have these practices. What are the actions that are being taken to get rid of this issue? There are many actions currently taken in the world, but here I'll list a few. Number 1, we can strengthen our laws. Strengthening our laws will discourage people from doing this medical procedure. Secondly, we should educate the rural areas, and tell the women about their rights, to give them a wider and broader understanding of the harms that comes from these practices. We as humans should come together and bring this issue up to the global stage, so that this issue does not bring forward to the next generation. With this, I conclude my presentation of female genital mutilation awareness. Thank you.